County Health Agency. Understanding Medicare enrollment periods. Medicare has different times of the year that you can enroll in a plan. Initial enrollment period, IEP. Medicare health insurance for people 65 or older. This is called your initial enrollment period. It lasts for 7 months, starting 3 months before you turn 65, and 3 months after the month you turn 65. Note, you may be eligible to get Medicare earlier if you have a disability, end-stage renal disease, or ESRD, or ALS called Lou Gehrig's disease. What can you do? Sign up for Medicare Advantage plan and or a Medicare drug plan. When will your plan be effective? If you enroll during your 3 months before you turn 65, it is effective the first day of the month that you turn 65. If you enroll after you turn 65, during the 3 months after you turn 65, the month after you turn 65, the first day of the next month. Annual enrollment period, AEP. Open enrollment period, Medicare Advantage, and Medicare drug coverage. What can we do? Change from original Medicare to Medicare Advantage plan. Change from a Medicare Advantage plan back to original Medicare. Switch from one Medicare Advantage plan to another Medicare Advantage plan. Or switch from a Medicare Advantage plan that doesn't offer drug coverage to a Medicare plan that offers drug coverage. You can switch from a Medicare Advantage plan that offers drug coverage to a Medicare Advantage plan that doesn't offer drug coverage. You can join a Medicare drug plan, switch from one Medicare drug plan to another Medicare drug plan, drop your Medicare drug coverage completely. When you can do this? October 15th to December 7th, and your plan coverage starts January 1st. Medicare Advantage Open Enrollment Period, OEP. Did you know that if you are unhappy with your Medicare Advantage plan, Medicare Part C, you have an option. Each year, there's a Medicare Advantage Open Enrollment Period from January 1st to March 31st. During this time, if you are in a Medicare Advantage plan and want to change your health plan, you can do one of these. Switch to a different Medicare Advantage plan with or without drug coverage. Go back to original Medicare, and if you need, also join a Medicare prescription drug plan. If you switch Medicare Advantage plans or go back to original Medicare with or without a Medicare drug plan, your new coverage will start the first day of the month after your new plan gets your request for coverage. Keep in mind, if you go back to original Medicare now, you may not be able to buy a Medicare supplement plan insurance Medigap policy depending on your health. Under Medicare, you need enrollment periods to change your plan. In some cases, you may have a special enrollment period called a SEP. You can change where you live. An SEP move. I moved to a new address which is not in my plan service area. What can you do? Switch to a new Medicare Advantage plan or Medicare prescription drug plan. When? If you tell your plan before you move, your chance to switch plans begins the month before the month you move and continue for 2 full months after you move. If you tell your plan after you move, your chance to switch plans begins the month you tell your plan plus 2 full months. Note, if you are in a Medicare Advantage MA plan and you move outside of your plan's service area, you can also choose to return to original Medicare. If you don't enroll in a new Medicare Advantage plan during that time explained above, you will be enrolled in the original Medicare when you are disenrolled from your old Medicare Advantage plan. You have changed where you live. I moved to a new address that is still in my plan service area, but I have a new option in your new location. What can you do? Switch to a new Medicare Advantage plan or Medicare prescription drug plan. When? If you tell your plan before you move, your chance to switch plans begins the month before the month you move and continue 2 full months after you move. If you tell your plan after you move, your chance to switch plans begins the month you tell your plan plus 2 more full months. You have changed where you live. I moved back to the U.S. after living outside the country. What can you do? Join a new Medicare Advantage plan or Medicare prescription drug plan. When? Your chance to join lasts for 2 full months after the month you move back to the United States. You have a special enrollment period if you move in or out of institution. You change where you live, SEP-INT. I just moved into, currently live in, but just moved out of institution, like a skilled nursing facility or long-term care hospital. What can you do? Join a Medicare Advantage plan or a Medicare prescription drug plan. Switch from your current plan to another Medicare. Advantage plan or Medicare prescription drug plan, drop your Medicare Advantage plan and return to original Medicare. Drop your Medicare prescription drug coverage when your chance to join, switch, or drop coverage lasts as long as you live in the institution and for 2 full months after the month you leave the institution. Medicare has a special enrollment period when you are released from jail. I am released from jail. What can you do? Join the Medicare Advantage plan or Medicare prescription drug plan when your chance to join the lasts for 2 full months after the month you are released from jail. If you live in an area that have a 5-star plan, you can have a 5-star special enrollment period. If a Medicare Advantage plan or Medicare drug plan or Medicare cost plan with a 5-star rating is available in your area, you can use the 5-star special enrollment period. What can you do? Switch from your current Medicare plan to a Medicare plan with a 5-star quality rating. When? You can use this enrollment period only once between December 8th and November 30th. Special enrollment period if you get extra help. SEP extra help. You are eligible for both Medicare and Medicaid. What can you do? Join, switch, or drop your Medicare Advantage plan or Medicare prescription drug coverage when? One time during each of these periods. January to March, April to June, July to September. If you make a change, it will take effect on the first day of the following month. You will have to wait for the next period to make another change. You can use the special enrollment period from October to December. However, all people with Medicare can make changes to their coverage from October 15 to December 7, and the changes will take effect January 1st. Special enrollment period if you get extra help. Your extra help for paying for Medicare drug coverage. What can you do? Join, switch, or drop your Medicare drug coverage when? Most people with Medicare can only make changes to their drug coverage at certain times of the year. If you have Medicare or receive extra help, you may be able to make changes to your coverage one time during each of these periods. January to March, April to June, July to September. If you make a change, it will begin the first day of the following month. You will have to wait for the next period to make another change. You can use the special enrollment period October, December. However, all people with Medicare can make changes to their coverage October 15 to December 7. These changes will begin on January 1st. SEP, extra help. You enrolled in a state pharmaceutical assistance program, SPAP, or lose SPAP eligibility. What can you do? Join a Medicare drug plan or Medicare Advantage plan with prescription drug coverage when? Once during the calendar year.
Comradery Health Agency, always trying to take the lead. www.comraderyhealthagency.com, or like us on Facebook, LinkedIn, or look at our YouTube channel.